Bismillahirrahmanirrahim. This is Dr. Usman Akhtar and welcome to my YouTube channel. Our today's topic is cardiomyopathies. The word itself says cardio mean heart, myo mean muscle, and pathy mean disease. So it literally means the disease of the muscle of the heart, that is myocardium. So whenever there is certain defect in the muscle of the heart, which is myocardium, the condition is called cardiomyopathy. Though it is a very diverse type of a disease, but I tried to collect few important causes for the cardiomyopathies which I listed here. The most important is primary and secondary. So primary, whenever the disease lies only in the myocardium, not any system. Only myocardium is involved. Some of them are congenital and some of them are idiopathic. We don't know the exact causes of that. Secondary to other systemic disease. For example, some other systemic disease having in our body, on top, because of that systemic disease, the heart muscle get involved. Like inflammatory conditions. The most important one is myocarditis. Immunological conditions or disorder like sarcoidosis. So sarcoidosis basically is a immunological disorder where most of our body organs get damaged. A heart is one of them. Metabolic disease like hemochromatosis. In hemochromatosis, the iron get overload in our body, so that overload iron get into the myocardium and cause cardiomyopathy. Infection like Coxsackie B virus, a viral infection, and so many other, but these are the top one, are important one to remember. If we look into the types of cardiomyopathies, the important one and the most common one, approximately 90% of cardiomyopathy is dilated cardiomyopathy, where there is dilation of the whole heart, or specifically we can say the ventricle get enlarged. So there will be systolic dysfunction and can lead to congestive heart failure. The another one is hypertrophic obstructive cardiomyopathy, which is also called idiopathic hypertrophic subaortic stenosis, or we can also say asymmetrical septal hypertrophy, where there is diastolic dysfunction. The heart cannot relax properly, so there will be congestive heart failure, or I should say there will be big flow, so there will be diastolic dysfunction. Another is restrictive cardiomyopathy. Here is also there is restriction in the both ventricles for the diastole, so there will be diastolic dysfunction. Another, which is a very rare type, left ventricle node compaction. It is basically a congenital condition of myocardium where the ventricle exactly look like spongy, so there will be still the contractile force will be absent, so there can be a systolic dysfunction. It is usually accompanied by congestive heart failure and arrhythmias. So it is a very rare one. Among all, dilated cardiomyopathy is the most important one, or I should say the most common one. And this hypertrophic obstructive cardiomyopathy, this usually lead to the sudden cardiac death in young athletes, especially like young players. Now if we look into the complication, it's very important to remember the complication of cardiomyopathies. The most important one is congestive heart failure. The heart fails to pump the blood either because of the diastolic dysfunction or systolic dysfunction. There can be arrhythmia as a complication of cardiomyopathy. The myocardium, or I should say the heart layer itself, start to eject abnormal impulses, which can lead to arrhythmias. These both, CCF, or I should say congestive cardiac failure, and arrhythmia, they are the main cause of death in cardiomyopathy. Another is mural thrombi. Sometimes because of the, for example, this is a heart, this is the endocardium. So because of some defect, there will be accumulation of platelet, or I should say there will be formation of thrombus, and because on top, if there is arrhythmia, this thrombi can detach from the layer of the heart, which is the endocardium, and that thrombus, or I should say thromboembolism, that emboli can go to any part of the body and can cause ischemia and infarction. Another is sudden cardiac death, and sudden cardiac death is most commonly seen with hypertrophic obstructive cardiomyopathy. So this type I will discuss in detail one by one in my upcoming videos. So